and good afternoon. So, today is a very interesting session. Today, we are going to have a talk on Alzheimer's, and I'm sure there are a lot of people who are unaware that there is such a disease which is known as Alzheimer's. And although we know very less about it, this disease is probably not much talked about, and we are not quite aware about what it is. So, we have got an expert with us today who will like to throw some light on this topic. She will try to clear all the doubts that are there in our mind regarding this disease, and she will firstly try to explain what is this disease all about. So we have Nikita with us. She is a clinical psychologist, and she's team CBT level 1 therapist and cognitive behavior therapy practitioner. She provides counseling, service, and deals with a variety of psychological disorders. Has worked with clients battling severe depression, anxiety attacks, disturbed interpersonal relationships, and OCD, panic disorders, and other severe mental problems and issues. She has also worked with children facing intellectual difficulties and specific learning disabilities like ADHD, autism, child counseling. Plus, she also excels in parenting counseling as well. She can talk on variety of subjects and which concerns the consciousness, the essence of self realization, and overall well being of a person. So, we are so lucky to have you, Nikita. Hi, how are you?
Hello, thanks for having me. I'm good.
Yeah, so we are so happy to have you today with us. And she is also an educator for 11th and 12th. So, are you taking psychology, Miss Nikita, for 11th and 12th?
Yes, ma'am.
So, what are the basic topics that you cover for the students?
Well, presently I'm working with the NCRT syllabus. So that syllabus in itself is so elaborative that class 11 and 12 students learn all the basic topics about psychology.
Okay, and I'm sure they are going to enjoy learning it with you because you are quite a company, right, ma'am?
Yes, yes.
Yeah, so today we are here talking about Alzheimer's. What I basically want to understand is what is Alzheimer's? What is this disease about?
Yes, this is very important to understand. Alzheimer's disease is actually a neurocognitive disorder. Neurocognitive disorder meaning it has to do with brain and brain areas, and the meaning of cognition is all the mental processes that are involved, meaning memory, learning, perception, knowledge, remembering. So, Alzheimer's is a neurocognitive disorder in which the patient's clinical deficits are there in the areas of cognitive functioning. So for example, they have problem with memory, learning, language, making sound judgment, as well as in social abilities.
Okay, ma'am. So I just want to understand the severity of this disease. Like, to what level can a person forget, and to what level can he have bad social behaviors? Like, not behavior actually, but relationship with others. How does it affect the relationship?
Yes, both things are involved. Firstly, in terms of severity level, we psychologists see it in terms of if it is a major neurocognitive disorder or if it comes in the mild category. Because if it
Okay.
is mild, then impairments are modest. It can be taken care to an extent, but if it comes in the level of major problem, then lot of cognitive deficits are there in many of the cognitive areas, not just one or two, but almost in all of the areas.
So, ma'am, you are talking about cognitive domain. Can you just elaborate what do you mean by cognitive domain here?
Yeah, so domain means when I'm referring to all the cognitive areas that are involved. So, for example, let's take up memory first. So, suppose like
Okay.
just now we are talking, now we both have the information that we are exchanging with each other held properly in our mind, right? But this patient suffering from this problem, they have difficulty holding on to any new or recent information as well as recalling the
So,
important, yeah.
So, does it mean that while I'm talking to you, and if I am a Alzheimer's patient, then I might forget what I'm trying to tell
Yes,
you, or I
yes.
might talk about things which are not related to the conversation? Does it mean
Yes,
this?
yes, that's a very good example, ma'am. So, yes, you won't
Okay.
be able to hold on to any new information, as well as will have difficulty in having a proper conversation with me, because your working memory or your short term memory will not be able to hold that information even for 20 to 30 seconds, which is the usual capacity of a human memory for short term memory, I mean. Then other areas, like they have difficulty with attention, which is very very important. Like for
Okay.
them, everything in their environment needs to be properly organized as well as simplified. You just one cannot give 3 to 4 instructions or tasks to them in one go. Like they will, that needs to be very very simplified. I would say one task at a time will help them. Otherwise, too much of distraction will affect them at another level also.
So
Then,
when I am
hmm,
giving more and more tasks, like if I'm giving 2 or 3 consecutive tasks to that person suffering from
hmm,
Alzheimer's, would they
hmm.
react in certain manner, showing displeasure or confusion or some violent behavior or anything like that? Or
Yes, that is also possible, because firstly they themselves could feel irritated or agitated at some point, because that understanding is there that I'm not able to comprehend or I'm not able to deal with what is going on around them. So that
okay,
irritability and restlessness could be there, which is clearly observable in their behaviors.
okay, okay. So now the age group is specified or no?
No, we can say that this Alzheimer's disease could start from the age of 40 or 45, but one needs to understand that this is not at all a developmental problem. This is not a problem which one acquires since birth. This is
Okay.
completely from the environmental, which could happen as one age. So it's not a developmental problem.
Problem. Okay, so we have to be rest assured that this will not occur to young, young people or children, or so children or young people are quite safe from having to acquire this disease. It is the after the 45, so the 45 plus. So we can be happy about this thing that the major portion of our life is not affected by this when we have to build a family or when we have to do a schooling or career. So we are quite
Yeah.
safe from this disease, right? This is what we can
Yes.
get from.
Yes.
Okay, so what
Yes.
are these what are the early signs of Alzheimer's? How do you know that you are having Alzheimer's? Or
Hmm.
as a person, do I come to know that I am having Alzheimer's, or I have to get it tested, or I have to see a doctor for that? Or
Yeah, here that's where the role of family, friends, and caregiver comes in. Suppose, let's take me as an example. Suppose, like all of this time, I have been functioning properly. My memory intact of all the main events of my life. My performance is very accomplishing, very achieving, and it's all going fine. Meaning, I'm managing my work, my family, my life, everything properly. My social interactions and everything is fine. But as soon as some cognitive problem occurs within me as a result of this disease, then there will be a problem with my memory, meaning the recalling and the remembering part won't be there. If this is very severe, then I might have difficulty even recognizing my own members or the other events of my life. Then performance wise, I won't be able to work the way I used to work. My social awareness and interest will narrow down. And in severe cases, like very severe cases, there could be empty speech. I mean, they could have difficulty in talking and relating, and their memory will be very severely impacted.
okay, so I also have one confusion here. In early
Hmm.
stages, we might forget things. For
Hmm.
example, if I have developed this, so early stages I am forgetting, but I can understand that I am developing some kind of disease, right? So, do I also understand this? That yes, I'm forgetting quite often now, and I'm not able to relate things. So, in initial stages, I tend to know that I am suffering from this. But when
That
it
is
goes
not
to a
same.
severity level,
No, no, that won't
uh,
be same for everyone, because this
okay,
level of severity is diagnosed by the expert. So, for example, like I said, it's a neurocognitive disorder. So, we as a
okay,
psychologist first check that their reports for all this problem is solved out, meaning the neurological reports are
neurological
there.
reports,
So,
okay,
caregivers and family members could be helpful more, and the person, let's say, who is experiencing, maybe just in the very early stages, may have a certain level of awareness, but one cannot say that they will have 100% level of awareness, because they
awareness.
themselves are confused and trying to figure out what is all happening there.
Okay, so they get irritated when they don't remember things, or but they don't understand the reason behind it. Is it that way?
Yeah, yeah, unless the entire psychoeducation is properly given to them, that this is what you are going through right now. Now your life has changed and all that you need to take care as a result of it.
And they might not even remember that also, right?
Yeah, that's the problem because of the memory impairment. Yes.
Okay, so how you said that friends and family play a great role in this.
Hmm.
So, as
Hmm.
friends and family, what are we supposed to take care about these? How, what are the sensitivity levels that we have to work on? Because this is quite tasking for both the one who is suffering and the one who is taking care of these people.
Of
So,
course.
does it
Of course.
happen that I just had my tea and I forget that I had my tea before 5 minutes, or I had my lunch and I keep on repeatedly asking for it? Does this also happen?
Yes, now this also differs in the range of cognitive disorders that are there. One thing I want to clear for our audience is that Alzheimer is actually the main cause of dementia. People may be familiar with that as well. So, dementia is also a severe impairment in memory. It starts with all of that. And the main cause of that forgetting, this forgetting is different from the normal or regular forgetting that one may
Forgetting.
experience. Yes, that is totally different. This is clinically significant impairment
Okay.
in
Okay.
memories there. So that starts with it, and Alzheimer is the main cause of it. And like you said, that having like you had a tea, one had a tea or lunch, and they might forget. That thing differs, but usually these patients, they become like a child. So they are more preoccupied with their bodily activities, like their eating, urination, defecation, what all they going to do, which they could comprehend. So they just completely become like a child, because there is no mental alertness also, there is no adaptability also. And therefore the role of a caregiver is very very important. We psychologists do suggest that the family members often like they can come for counseling sessions, because it is difficult for them as well. They have to hold on to their frustration or any kind of conflict that could be there. Few
So, in
suggestions which, hmm,
yes,
yeah,
ma'am.
please.
Yes, ma'am. Please continue. So sorry.
No, no. Few suggestions like simplified routine will be helpful for them. Like throughout the day, suppose this time they have to wake up, then they have their breakfast, then other any routine tasks, taking medicine. These tasks that are very very simplified for them, which just like a child if they can follow. Of course, with certain reminders throughout the day, they can keep a diary or certain quotes or stickers around on the wall or somewhere where they can see daily or repeatedly in a day. All of these little things will be helpful for them.
Okay, ma'am. So, any food habits that need to be taken care in these, or they can have anything and everything, or anything like that?
Yeah, this depends, but I would say that the healthy diet would be helpful for them, only because like these patients also have to go for medicines, and any medicines will have its own impact. So their health, their food habits, their dietary habits, of course, needs to be taken care.
Care of. Okay. You also suggested in between that the caretakers need to take psychological sessions. So,
Hmm.
is it because you said that over a period of time, so you don't have any expiry for this disease, or it will not get better? Does this get better with medicines, or it is there is no chance of getting better with medicines?
That's a very, very important question again. See, after diagnosis, The survival rate of these patients could be for 11 to 20 years, but this depends on the level of severity. So one cannot
Okay.
say for sure that this is what they will be like. Because if the severity level is from mild to moderate to mild level, then with environmental help, with psychological help, and with medicines, certain level of cognitive impairment can be controlled, like this memory impairment, language expression, psychomotor activity. This few of the things can be taken care to an extent. But if it's severe, then yes, their life expectancy is affected.
Okay. Okay. So if you say that 11 years or 20 years, that's a quite a big span of a person to have Alzheimer's, and it is more tiring for those who are taking care of
Yes,
that
research
person,
says that
right?
after diagnosis, yeah, like around 10 to 15 years, they might survive, like I said, but depending on the level of what they are
Level of
going through.
severity. So
Yes.
a lot of patience and lot of counseling has to be done, even for the caregivers, and a lot of motivation again,
Mm-hmm.
positivity for them, because it does not seem as easy as we talk about it. It seems
Hmm.
quite challenging to take care of a person who is constantly forgetting and constantly getting lost with day-to-day activities, which is really tiring for other people around uh, the
Of
patient.
course. Yes, of course.
Yes.
In fact,
Uh,
these
uh,
patients can also be given like behavioral treatments by a psychologist, as in if the caretaker and the patient himself or herself takes care of which behaviors they want to repeat more often and which they don't want to, just like a child, just like we teach a child that this is suppose you have to follow, otherwise there is a punishment to it, but if you follow this correctly, then there is a reward for you. So likewise they can be trained behavior wise also. Because of their impairment in brain areas, they might not function well like a
well,
proper human being in the society. So certain challenges could be there in that context as well. So there, those things
okay.
can be
So,
taken
ma'am,
care.
as a psychologist, how do you recognize
Hmm.
Alzheimer patient? How do you know that the patient is suffering from this disease?
Yes, so here input of the family members is of course important because they are the ones, the primary ones who have been noticing certain changes in them, and also we follow the neurological reports that they give to us, and otherwise we see that the problem with them is probable Alzheimer disease or possible Alzheimer disease. Meaning, if it is probable, then the severity functions could be in just one or few of the cognitive areas, which we just discussed earlier.
Discussed.
And if
Okay.
it is and if it is possible, then many more of the symptoms will be there. Meaning, more cognitive impairment could be there.
Okay. Okay, ma'am. So, are there any specific things that a caregiver needs to learn while taking care of such patients? Do they have to also undergo some, trainings for taking care of these patients?
Well, I would say yes to that only because that the person who is taking care of the patient is also a human being, and as a human being, everyone has their own challenges and conflicts. And of course, when this patient who is completely reliant and dependent on you almost for all the activities, then any expert can help the caretaker, as in what they can do, what they should do, what they should not do. And also depending on the personality of the patient, meaning the family must have known them for like years, right? So they can just
Okay.
focus more on their strength area. And also this is important that Alzheimer is a disease. We don't have to label the person who is going through it.
Okay.
We must separate the label, the problem with the person. So the caretaker can focus on the problematic behavior that are there, that are manifested as a result of a disease, and not to really label the person, otherwise it could go very very challenging for them as well.
Yes, ma'am. This was so informative, Nikita, ma'am, and I'm so happy that we've got so much to know today. I myself was not aware about so deeply about this subject, and I am sure this has helped all of our viewers. And this is such an informative session that I have attended today with you. So thank you so
Thank
much for all your knowledge that you have given to us, ma'am.
thank you so much. Thank you.
Yeah. Thank you for being with us, all of you on Parent Station, and hope to see you soon with again some nice topic, some informative things from us. See you all tomorrow. Bye.
Thank you. Bye bye.